Imagine waking up every day, feeling like your body is working against you. Your reflection feels unfamiliar. Your emotions, they are a roller coaster. And the world, it just doesn't seem to understand. You feel alone. For millions living with polycystic ovary syndrome, commonly known as PCOS, this isn't just a bad day, it's their reality. But why is this condition so misunderstood, and how can we change that? In this video, we will be discussing PCOS and its effects on mental health. So by now you must be thinking, what is PCOS? PCOS is a hormonal condition that affects a woman's ovaries. It affects up to 15% of women in the reproductive age. Symptoms may include irregular periods, polycystic ovaries, and high androgen levels. Some causes of PCOS are insulin resistance, a family history of PCOS, and low-grade inflammation. Some complications include type 2 diabetes, infertility, high blood pressure, miscarriage, cancer of the uterine lining, mental illness, and many more things. To find more information on PCOS, you can visit these other videos on our YouTube channel. Now, how does PCOS affect mental health? Hormonal imbalances are a key characteristic of PCOS. This can contribute to mood disturbances and can increase the risk of mental health disorders because these imbalances don't just affect the body, they also influence the brain. Studies show that up to 40% of women with PCOS have anxiety disorders, while up to 25% experience depression. Women with PCOS are also more likely to receive clinical diagnoses of bipolar disorder and obsessive-compulsive disorder compared to those without PCOS. Interestingly, research also suggests that children born to women with PCOS have a higher likelihood of developing neurodevelopmental conditions such as attention deficit hyperactivity disorder and autism spectrum disorder. This highlights how the effects of PCOS may extend beyond the individual and can influence future generations as well. The societal pressures tied to fertility concerns often add another layer of stress. Questions like, will I be able to have children, or how will this affect my relationship, contribute to emotional distress and constrain partnerships. The physical symptoms of PCOS, like weight gain, acne, and excessive hair growth in a male-like pattern, are often visible and can negatively impact self-esteem. Unfortunately, these struggles are made worse by societal beauty standards that promote unrealistic ideals. For many individuals with PCOS, this can lead to body dissatisfaction and even the development of eating disorders. Studies show that individuals with PCOS are 3 to 6 times more likely to have an eating disorder compared to those without the condition. Among individuals with PCOS, 30% show a higher risk of developing bulimia nervosa, and the prevalence of binging disorder is 3 times higher than in those without PCOS. These patterns are often rooted in a complex mix of hormonal imbalances, emotional distress, and societal pressures. Recognizing and addressing these concerns is crucial. Early intervention, therapy, and a strong support system can help individuals navigate these challenges. When it comes to managing the mental health impacts of PCOS, a holistic approach can make a world of difference. Exercise, for example, not only benefits physical health, but has also been shown to improve mood, reduce anxiety, and boost overall well-being. Whether it's a brisk walk, a yoga class, or a fun dance session, staying active is a powerful tool. For some individuals, medications play an important role. Antidepressants and anti-anxiety treatments can help regulate mood, while metformin, commonly used to manage insulin resistance, may indirectly improve mental health by addressing the underlying symptoms of PCOS. Alternative approaches like acupuncture, mindfulness practices, and cognitive behavioral therapy can also offer relief. These strategies target both the mind and the body, promoting relaxation and helping individuals navigate the emotional challenges of PCOS. While managing PCOS is essential, breaking the stigma surrounding it is just as important. Advocacy and awareness can create a more informed and empathetic society. Public awareness campaigns on social media, television, and at community events are powerful tools to spread accurate information, debunk myths, and foster understanding. Education within healthcare settings is also vital. By equipping healthcare professionals with the knowledge to recognize and address the psychological impacts of PCOS, we can ensure holistic, patient-centered care. Too often, PCOS symptoms are dismissed or overlooked, leading to a delayed diagnosis and a lack of proper education for patients. Many express feeling overwhelmed and fearful after their diagnosis due to insufficient information about treatment options and long-term implications. Bridging these gaps start with better resources for patients and improved education for healthcare providers. PCOS is a journey that affects every aspect of life, physical, emotional, and social. But with the right strategies, support, and awareness, it's a journey that doesn't have to be taken alone. By managing mental health, advocating for better resources, and raising awareness, we can empower individuals with PCOS to live their fullest lives. Together, we can break the stigma and ensure that no one feels alone in their PCOS journey.